Welcome to my channel. If you were diagnosed with Parkinson's disease and your doctor or provider is telling you to start doing exercises, but you don't know how to, or you cannot afford a physical therapist or a personal trainer, then this video is for you. Even if you don't have Parkinson's disease and you want to start from zero. Let me start by saying that it doesn't matter how many medications do you take, how many supplements, injections, or surgery you get. If you don't do exercise and push yourself out of your comfort zone, things are not going to work well, and you are not going to get your maximum potential. I'm not talking about the exercises that you do when you wake up early in the morning and you go to the bathroom, to the kitchen. No, I'm talking about a consistent, progressive exercise program designed by a professional in the area. Today, I will show you my simple and practical exercise program for beginners with Parkinson's disease. Why do I say beginners? Because more than 75% of the US population in 2020 did not meet the physical activity guidelines for aerobic and muscle strengthening activity based on the CDC statistic published in 2022. The link will be in the description of this video. You can see here highlighted what they mean with sufficient exercise. Now, I will tell you that this is an estimate based on household interviews in US. I think these numbers are worse. Just take a look around you, count 10 people, and ask them how many of them are doing this and how many of them are obese. The providers usually use this scale that you see in the screen to make the diagnosis of obesity. Now, be careful with the BMI interpretation in people with large muscle mass because based on this scale, they are obese. Many of them are obese or at least overweight, but the fat percent of this population is very low, and they can run very fast. So you cannot apply the BMI scale to, for example, football players or track and field sprinters. This is different. Now, let's start 5 steps that I highly recommend before you start an exercise program, especially in the setting of Parkinson's disease. Number 1, and you will see each one here in the corner. Number 1, it is essential to check with your doctor if you are okay to do these type of exercises from the cardiac standpoint. Some patients might require a cardiac evaluation before beginning an exercise program. Your primary care provider, your primary care physician can guide you if you are one of those patients, if you need this evaluation. If you want to know how safe is exercising in PD, watch this video and go to the chapter 956. Step number 2, and this might sound silly, but I think it's important. It is very important to write down your plan and sign the paper. It's like a contract. And this might help you psychologically. By doing this, you create a psychological commitment with yourself, to yourself, that can be a helpful motivator. Don't forget that the main limiting factor in many patients with Parkinson's disease, and even in the general population, but worse in people with Parkinson's disease, is the lack of motivation. We call that apathy. This is why you need to have a schedule, a routine. Exercises should be at the same time every day. Sounds boring, but this is how the things work. If you write down that you will start exercises at 9 a.m., it's at 9 a.m., not at 10:30. Because if you do that, it's not going to work. You need to be very specific and be consistent. Step number 3, Start Monday. So if you're going to start your exercise program, start from the beginning. Monday is the first day. That's the day to start. That facilitates your thinking process. Now, make sure that you take your Parkinson medication at least 1 hour before the exercises, so you can be on your peak of your medication effect. Number 4, and you will see number 4 here. Take your medication with cool water, okay? With cool water. Number 5, very important, do not be discouraged, okay? If you don't want to do this for yourself, do it for the people who care about you, your family. Also, when people see you improving, they get interested in knowing what are you doing. And this also motivates you to continue and push yourself even more. I understand exercises is very, very painful and not fun. Sometimes it's not fun. It's mentally painful. But in long term, you will notice the difference in your quality of life and function. Now it's time to go to the gym. This routine is for patients, for people who are able to walk, even with a walker. However, you still can incorporate some of these exercises with some modification. For example, you can do the exercises, some of them, in a sitting position. I am not going to spend time telling you about the reason behind this type of routine, but enough to say that we will incorporate some techniques used in track and field, sprinters, a sport that I am passionate about it, you can tell. And in other words, techniques to make you faster. Remember, what is the main problem in patients with Parkinson? Slowness, bradykinesia, slow movement. So this routine is to make you faster. That's number 1. Number 2, coordinated, flexible, and stronger, but minimizing injuries. That's the key. Why? Because this is a big limiting factor in anybody over 35 with and without Parkinson's disease. Now let's talk specifically about the routine. We will divide this routine in 3 phases, 3 stages. Station number 1, 2, and 3. Station number 1 is the warming up phase. And like you see, this patient walking in the treadmill, as in any track and field athletes, warming up is crucial, extremely important. You can walk in a comfortable pace for 3 to 5 minutes. When I say comfortable pace, I mean the pace that you are able to talk without any problem. You can have a conversation without any problem. The idea is to get the muscles ready, activating the muscle and minimizing injuries. We are susceptible to injury, and as I mentioned before, this is one of the limiting factors in many of us. If you cannot perform tandem gait and you have Parkinson's disease, do not use the treadmill. When I say tandem gait, this is tandem gait. If you cannot do that, do not use the treadmill because it is unsafe if you are alone. You have a fall from the treadmill, which is very common, especially in people with balance issues. You will end up in the hospital and possibly with a fracture. Not only that, the idea of walking in a treadmill when you have Parkinson is to move the arms. So if you walk on a treadmill with balance issues, you will be holding the machine. So the proper gait cycle and the arm swing are almost impossible. If this is the case for you, then just walk from one corner to the other corner in your house or outside in your neighborhood, around your house if you can, but on a flat, even surface. Remember, every time that you are doing exercises, you need to warm up. We are in the warming up stage, okay? You cannot walk in the treadmill or you cannot walk outside for whatever reason. Then you have options. One of the options is marching in the same place, like this patient here, or biking, a stationary bike. So remember, you just need to warm up for 3 to 5 minutes. It's just the idea is to prevent lesions and to prepare the muscle for the exercises. Now let's start stage 2 or step 2. Here we are going to do drills, breathing exercises, balance exercises, and dynamic stretching. Try to do this 6 days per week. Take 1 day off per week. Now, the first exercise, and this is exercise number 1, is a slow neck rotation. You see, chin to shoulder. Slow movements. You can do this exercise for 10 to 15 seconds. Okay, let's see now exercise number 2. So this exercise, basically you mix 2 types of exercises, breathing exercises and dynamic stretching. So let me show you. So basically, arms down, all the way up, arms all the way up, all the way up, but try to do it like this, facing each other, the palm facing each other. When you go all the way up, you wait 3 seconds approximately, stretching like this, stretching all the way up with eyes closed, and then exhale. When you go down, exhale, like if you are introducing energy inside of your body when you exhale. Okay, and you repeat the same movement again. Eyes closed. 3 times. Okay, these exercises also help you to be relaxed. By the way, there is nothing better to have a dog next to you while you're doing exercises. That might help you with motivation, which is a big deal, not just in patients with Parkinson's disease. Here you have exercise number 3 that incorporate balance exercises and dynamic stretching. Let me do it again. It's better you to watch the video than me explaining the movement. So you can do these exercises 8 to 10 times to each side, and you can do 2 sets. Remember, exercises need to progress in terms of the amount. So you can start even with 1 set of 8 repetitions, and after a few weeks you can increase progressively. This is exercise number 4. You can do this exercise sitting or standing, depend if you have balance issues, significant balance issues, then you can start doing exercise in sitting position. But this is basically rotation of the trunk to improve mobility in the trunk. So you can do these exercises for 20 seconds or 10 repetition each side. You can do 1 set, 2 set, 3 sets. Everything depends of your stage. But remember that you need to progress. You cannot stay just doing 1 set of 10 repetition. You need to increase progressively. And maybe you might need to wait 1 or 2 weeks to progress. Every patient is different. This is exercise number 5. You can do this exercise sitting or standing position, depend of your balance. Now, here, basically what you are doing is try to inhale and then exhale. Inhale, and you are stretching this muscle here, the pectoralis muscle. Exhale 3 times. And you feel the contraction of this muscle, the contraction and the stretching. Contraction and stretching. Okay, and try to breathe. So this basically you incorporate breathing and dynamic stretching. This is exercise number 6. You can do 10 repetitions each side. You can do 1 set, 2 sets, but remember you need to progress. Better you to watch the video instead of me explaining the movement. This is exercise number 7. Exercise number 7. So here I'm doing rotation, circular motion, rotation of the shoulder. Very important, these type of exercises in patients with Parkinson, because patients with Parkinson, they have significant stiffness of the shoulder. You can start sitting position, or you can do in standing position, but a little bit, you have to flex the trunk a little bit forward. And this is how you do it. And I'm doing exercises in the kitchen. Why? Because it's close to the sink, so you can hold this area here if you need to. Okay, circular motion and flexion extension. Okay, you can do 10 seconds each arm. Exercise number 8. So here we are exaggerating arm swing like sprinters. You can do these exercises sitting position or standing. I prefer standing to work also with balance, but if you have balance issues or significant balance issues, just start sitting position. You can do 10 seconds each side. Now let's incorporate more balance and coordination. So these are exercises 9 and 10. So let's start talking about this one, the 9, which is basically a narrow base support for 30 seconds. You might need to be, if you have significant balance issues, you might need to be close to something solid, something fixed, like the kitchen, the sink of the kitchen. Then the other exercise is this one, which is one leg stance. So you can tell that he's having a hard time with this. So if you flex more the knee, at this level, right? So it's going to be more difficult. If you keep the knee, the foot close to the floor, will be easier. So this is one of the techniques that you can use to make the exercises more difficult, okay? So 30 seconds each leg and 30 seconds here. This is exercises number 11. Number 11. So here I am performing leg swing, which is actually a drill, and it's dynamic stretching exercises. Maybe help with a little bit of balance too, but mostly it's dynamic stretching. So if you want to make things more complex, you do it in this way, which require a little bit more coordination. And you can tell that he's having hard issues to coordinate the movements. Okay. So this is more difficult than this one. This one is easier. So you can start with this one. You can do 10 times each side, 10 times each side here, and progress. You can do 1 set, 2 sets, but remember that you need to progress. This is exercise number 12. You hold the sink, right, or anything solid, and this is a lateral weight shift exercise. You can do 10 times to each side, to the right and to the left. This is exercise number 13. Very important balance exercises. The name is tandem gait. You can start forward, but to make things more complex, you can do it backward too, when you are ready to do it. But very important to do it. This is exercise number 14. We call this alternating backward stepping. So basically, you hold the sink, like I'm doing here. You move your center of gravity backward, and after approximately 1 second, you move as quick as you can one of the leg backward. Okay, you can start with the right, or you can start with the left. It doesn't matter. Very important exercise for patients that they have postural instability. So basically, when the doctor pull you from behind, they are checking postural instability. Normally, a normal patient, you cannot take more than 2 steps backward. Otherwise, then you are classified as a patient with postural instability, and you are higher risk of having falls. This is exercise number 15. Alternate stepping. So basically, you need a pillow or something that you can tap with your foot. You alternate between the leg and the arm in this way I'm doing here. You can do 10 times each side, 1 or 2 sets. We already discussed about 15 exercises to improve your mobility and coordination, but also to help you to feel more relaxed because help you with the breathing. We are working with the breathing as well. Now we are going to talk about 9 exercises to make you stronger, to improve your power. I'm talking about resistance exercises. These exercises, you need to do it twice per week, at least during the beginning, twice per week. The other 15 that we already talked, 6 days per week. That's different, okay? Now I'm talking about resistance exercises. So not every day and not consecutive days, because you need to have at least 48 hours, 2 days between exercise section to allow the muscle to recover. Okay, this is very important. So first day is Monday for resistance exercises. The second day will be Thursday. And you do this for 6 weeks. And after 6 weeks, you increase to 3 days per week. Monday, Thursday, and Saturday. Let's start with exercise number 1. So exercise number 1, we are working the hips. And we are actually going to work all major muscles except the back and the bicep, okay? So here, this might be too easy for you. That's fine. I want you to start easy for 2 or 3 weeks, and then you progress with resistant exercises. So if you see, I put something for caution here because the band causes pain when you put it like this. So try to find out something to protect from the pressure that you feel from the bands. So you can do 3 sets, 2 sets, 3 sets of 10 repetition or 8 repetition, okay? This is exercise number 2. Sit to stand, very important exercises to work with your quadriceps. So you can start with half squat, and then after a month or so, you progress to full squat, okay? Like now, full squat. So you can do 2 sets of 8 to 10 repetition, and then after a few weeks or a month, you can progress to 3 sets. This is exercise number 3. We call this wall knee drive. So you can start like this, and then after a few weeks of doing this, or at least a month, you can start doing like this. So I'm using more the gastrocnemius, this muscle here. So you can do 2 sets of 10 repetition each leg. And if this is too easy for you in the future, you can use ankle weights. Now this is exercise number 4 and number 5. Number 4 and number 5. This group of muscles are very important, especially if you have what we call orthostatic hypotension. The blood pressure drop when you stand up. Very important, especially this one here, this muscle here, the soleus. So you can find something like this, or you can put 2 books that you don't like. So the idea is to have a full range of motion, okay? Full range of motion. So you can do 2 sets of each exercise, 8 to 10 repetitions. Actually, this muscle is a postural muscle. The soleus is a postural muscle that sometimes require a little bit higher repetition, maybe 20 to 25 repetitions. The next exercise number 6, very important exercises as well. So we call this dorsiflexion of the ankle. So you can do 3 sets of 10 repetition. This will be easy for you, but that's okay. And you can progress to walking on hills. So more difficult and require more balance. So people with balance issues will have a hard time doing this. So you have to be careful. Now, exercise number 7, and we are going to work a little bit more the upper body. And this is what we call wall push-ups. Try to do 2 sets or 3 sets of 8 to 10 repetition. The next exercise is exercise number 8, and we call this resistant band tricep extension. And you can do 2 sets of 8 to 10 repetition each arm. Exercise number 9 and the last one. This is a very important exercise, working your gluteal area, your abdomen, your core, and a little bit the quadriceps as well. So you can sustain the contraction for 2 or 3 seconds, and then you go down, like he's doing now, 2 or 3 seconds, and he goes down. And you do 2 sets, 8 to 10 repetition, and then you progress to 3 when you are ready to do so. Just to summarize a few points. Point number 1, the key is to be consistent. You need to be consistent with exercises. You need to have a structure. You need to have a schedule. Otherwise, things are not going to work well. Levodopa, deep brain stimulation are not enough. If you want to have a better quality of life, you need to do exercises. If motivation is a big issue, big limiting factor for the general population, it's even worse for patients with Parkinson's disease, probably because it's a chemical problem. Now, I have a lot of respect for those patients who are doing moderate to high intensity exercises, because this is not easy. If you like this video, don't forget to subscribe to my channel. See you soon.